Schizophrenia was initially identified over a century ago, yet the precise origins of this condition remain elusive. It continues to be one of the most misunderstood and stigmatized mental illnesses in contemporary society. Let's delve into what we have learned so far, encompassing symptoms, potential causes, and available treatments. What are the symptoms? Schizophrenia is categorized as a syndrome, which implies that it may encompass several related disorders sharing similar symptoms but varying causes. Each individual with schizophrenia exhibits slightly different symptoms, and the initial signs can be subtle, such as gradual changes in personality, heightened irritability, or the gradual emergence of unusual thoughts. Patients are typically diagnosed following the onset of psychosis, which typically emerges during the late teens or early 20s in men and the late 20s or early 30s in women. A first episode of psychosis may manifest as delusions, hallucinations, and disrupted speech and behavior. These are termed positive symptoms because they occur in individuals with schizophrenia, but not in the general population. It's important to clarify that the belief that individuals with schizophrenia have multiple personalities is a common misconception. These symptoms indicate a disturbance in thought processes rather than the presence of multiple personalities. Is there any negative symptoms of schizophrenia? Schizophrenia also presents negative symptoms, which involve reduced qualities like motivation, emotional expression, or speech. Additionally, cognitive symptoms may arise, including difficulties with concentration, memory retention, and decision-making. Regarding the causes of psychosis onset, it is likely not attributable to a single factor, but rather a combination of genetic and environmental risk factors. Schizophrenia boasts some of the most robust genetic associations among psychiatric disorders. Understanding schizophrenia is an ongoing process, and research continues to uncover more about its complexities. Reducing stigma, increasing awareness, and supporting those affected by this condition are essential steps toward improving the lives of individuals living with schizophrenia. Although approximately one of the population is affected by schizophrenia, the risk of developing the condition is notably higher for children or siblings of individuals with schizophrenia. In fact, they are 10 times more likely to develop the disease. For identical twins of someone with schizophrenia, the risk is even more substantial, with a 40% chance of being affected. Frequently, close relatives of individuals with schizophrenia may exhibit milder versions of traits associated with the disorder, albeit not to an extent that necessitates treatment. While multiple genes are believed to play a role in the development of schizophrenia, the specific number and identities of these genes remain unknown. Environmental factors. Environmental factors, such as early infancy exposure to certain viruses, may elevate the likelihood of developing schizophrenia. Additionally, the use of certain substances, including marijuana, can potentially trigger the onset of psychosis in individuals who are highly susceptible. It's important to note that these factors do not impact everyone in the same way. Those with very low genetic risk are unlikely to develop schizophrenia, regardless of exposure to environmental risk factors, while those with a very high genetic risk may be more susceptible to the influence of such factors. What treatment options are available? Antipsychotic medications used in the treatment of schizophrenia have been instrumental in helping researchers identify signatures of the disorder within the brain. Traditional antipsychotics function by blocking dopamine receptors and are particularly effective in reducing positive symptoms associated with an excess of dopamine in specific brain pathways. However, these same medications can exacerbate negative symptoms, which may be linked to insufficient dopamine in other brain regions. In some cases, individuals with schizophrenia may exhibit neural tissue loss, though it remains uncertain whether this atrophy is a consequence of the disease itself or a result of drug-induced signaling suppression. Fortunately, newer generations of antipsychotics have been developed to address these challenges by targeting multiple neurotransmitters, including serotonin in addition to dopamine. These advancements aim to provide more comprehensive treatment options for individuals with schizophrenia. It is evident that no single neurotransmitter system can account for all symptoms of schizophrenia. Because antipsychotic medications influence signaling processes throughout the brain and body, they can give rise to additional side effects, such as weight gain. Despite these complexities, antipsychotic medications can be highly effective, particularly when used in conjunction with other therapeutic approaches like cognitive behavioral therapy. Electroconvulsive therapy, while providing relatively short-lived relief, is also re-emerging as a viable treatment option, particularly when other treatments have proven ineffective. Early intervention plays a crucial role in the management of schizophrenia. After months or years of untreated psychosis, certain aspects of the condition can become deeply ingrained in an individual's personality. However, the stigma associated with this diagnosis often deters people from seeking the help they need. It's important to recognize that individuals with schizophrenia are frequently perceived as dangerous, though they are statistically more likely to be victims of violence rather than perpetrators. Moreover, appropriate treatment can help mitigate the risk of violence associated with schizophrenia. This underscores the significance of education for patients, their families, and their communities, as it serves to diminish stigma and enhance access to treatment. Our journey through the complex landscape of schizophrenia has illuminated the challenges and misconceptions surrounding this condition. Schizophrenia remains a deeply misunderstood and stigmatized mental illness, but with vital knowledge and compassion, we can make a difference. If you or someone you know is dealing with schizophrenia, remember that there is hope. Early intervention and appropriate treatment can lead to better outcomes and improved quality of life. Reach out to healthcare professionals and support networks to navigate this journey together. Thank you for joining us on this exploration of schizophrenia. Let's continue to learn, empathize, and advocate for mental health awareness and support. Together, we can make a positive impact in the lives of those affected by schizophrenia and work towards a more compassionate and inclusive world.